Hello everyone, and welcome. I'm excited to kick off our presentation today with episode 13. This is our very first slide, so I want to warmly greet you all and introduce the topic we'll be exploring together. Today's focus will be on some fascinating insights and key points that I believe you'll find very engaging. Over the course of this session, we'll cover the main themes, highlight important takeaways, and hopefully spark some new ideas. But for now, let's get started and enjoy the journey ahead. Let's consider the key question here. During the first several hours after a cardiac catheterization, what is the most essential action for Nurse Sree to take? Now, looking at the options, we want to focus on what really matters immediately post-procedure. First, elevating the client's bed at 45 degrees can help reduce bleeding at the insertion site, but it's not always the top priority right after the procedure. Second, instructing the client to cough and deep breathe every 2 hours is good for lung expansion, but it's more relevant during recovery from anesthesia or to prevent atelectasis, not the immediate post-catheterization period. Third, frequently monitoring the client's apical pulse and blood pressure is crucial. These vital signs can quickly indicate bleeding, hematoma formation, or other complications. Continuous monitoring allows us to catch issues early and intervene promptly. Finally, monitoring the client's temperature every hour isn't typically an immediate concern in this context, unless there are signs of infection, which usually develop later. So, connecting all these points, the most critical action in those first hours is to closely monitor the client's vital signs, specifically the apical pulse and blood pressure. This helps ensure early detection of any bleeding or hemodynamic instability, which is vital for patient safety after a cardiac catheterization. In summary, vigilant monitoring of vital signs is the key priority during this critical period. Let's talk about the importance of frequently monitoring the client's apical pulse and blood pressure. Keeping a close eye on these vital signs is crucial because they provide us with real-time information about the client's cardiovascular status. The apical pulse, which we often measure with a stethoscope at the apex of the heart, gives us an accurate count of the heartbeat, especially in clients with irregular rhythms. Blood pressure readings tell us how effectively the heart is pumping and whether there might be issues like hypertension or hypotension. By monitoring these parameters regularly, we can detect any changes early and respond promptly, ensuring the client's safety and well-being. This practice is fundamental in managing clients with cardiac concerns or those receiving certain medications. Consistent monitoring helps us make informed decisions and tailor our interventions to support the client's health effectively. During the first several hours after cardiac catheterization, the most crucial nursing action is close monitoring of the patient's cardiovascular status. This means paying careful attention to vital signs, especially the apical pulse and blood pressure. These measurements are vital because they help us detect early signs of complications such as bleeding or hemorrhage, which can be life-threatening if not caught promptly. Hypotension is another critical sign we watch for, as it can indicate significant blood loss or other issues. We also need to be vigilant for dysrhythmias or abnormal heart rhythms, which can develop after the procedure and may require immediate intervention. Early signs of shock are also something we need to recognize quickly. Shock can occur if there's severe bleeding or other complications, and early detection is essential for a positive outcome. Remember, these complications are potentially life-threatening, and identifying them early is key to providing safe and effective care. So, constant monitoring during this period is absolutely essential to ensure patient safety and to intervene promptly if any issues arise. These are life-threatening complications and must be identified early. It's crucial to recognize the signs and symptoms as soon as they appear because early detection can make a significant difference in patient outcomes. When we talk about life-threatening issues, we're referring to conditions that can rapidly worsen and potentially lead to severe harm or even death if not managed promptly. Throughout this presentation, we've emphasized the importance of vigilance and prompt intervention. So, keep in mind that catching these complications early is key to providing the best care possible, and preventing serious consequences. All right, let's talk about some important post-procedure care points. First, elevating the bed to 45 degrees is generally not recommended initially. Typically, we keep the patient flat or with the head of the bed slightly elevated, especially if we're using a radial approach. This helps prevent bleeding or hematoma formation at the puncture site. Next, having the patient cough and deep breathe every 2 hours is important. It helps prevent atelectasis and promotes lung expansion, but it's not the immediate priority right after the procedure. We focus more on initial stabilization first. Then, monitoring the temperature every hour is crucial because a fever might signal infection or a reaction to contrast dye. Still, fever isn't our immediate concern right after the procedure. We need to watch for other signs first. And why not the other interventions? Well, elevating the bed too early could increase bleeding risk. Coughing too soon might cause strain or bleeding at the puncture site. And focusing solely on temperature without considering other vital signs could miss more urgent issues. So, these steps are part of a careful, prioritized approach to ensure patient safety and optimal recovery. Now, let's focus on the post-cardiac catheterization priorities. After the procedure, it's crucial to monitor vital signs closely to detect any signs of instability early on. We also need to check the puncture site carefully for any bleeding or signs of hematoma formation. Peripheral pulses are important to assess because they help us ensure that blood flow is maintained beyond the catheter insertion point. And of course, keeping an eye on bleeding at the puncture site is vital. Any excessive bleeding needs prompt attention. These steps are key to ensuring patient safety and preventing complications. Remember, consistent monitoring and prompt response are essential components of effective post-procedure care.